When people hear allergy, they often think of sneezing, hives, pollen, or food reactions. But hypersensitivity is broader. It means the immune system reacts too strongly, reacts to the wrong target, or causes tissue damage while trying to protect the body. The immune system normally protects us from bacteria, viruses, and other threats. Sometimes it misreads the situation. It may overreact to something harmless, or it may mistake part of the body for an enemy. Type 1 hypersensitivity is the classic allergy pathway. Pollen, foods, insect stings, or medications can trigger IgA and mast cells. This can cause sneezing, runny nose, itchy eyes, hives, asthma symptoms, or in severe cases, anaphylaxis. Type 2 happens when antibodies attach to the surface of cells and mark them for attack. If red blood cells are affected, anemia can occur. If platelets are affected, bruising or bleeding can happen. Some autoimmune blistering skin diseases also work this way. Type 3 occurs when antigen and antibody clusters are not cleared well. They can settle in blood vessels, joints, kidneys, or skin and cause inflammation. Examples include lupus, some types of vasculitis, and some kidney inflammation. Type 4 is slower and is driven by T cells. Symptoms may appear 1 or 2 days after exposure. Nickel earrings, hair dye, fragrances, cosmetics, rubber products, or some medications can trigger this kind of reaction. Type 5 is sometimes described separately. Instead of destroying cells, antibodies change how receptors work. In Graves' disease, antibodies stimulate the thyroid gland, which can cause palpitations, sweating, and weight loss. Hypersensitivity includes immediate allergy, antibody-related cell injury, immune complex disease, delayed T-cell reactions, and receptor dysfunction. This is why hives, asthma, lupus, vasculitis, contact dermatitis, and thyroid autoimmunity can be connected through one immune concept.